Hi, and welcome to the psychology of human behavior. In this video, you are going to learn how to cope with anxiety. When your heart starts beating faster or your hands start sweating in a stressful situation, that is your body's natural response to stress, also known as anxiety. Here are a few common triggers for anxiety. Giving a presentation in front of people, starting a new job, meeting your spouse's parents. We all have different triggers, so finding out what your triggers are. This is the start to coping and managing anxiety attacks. Fast ways to cope with your anxiety. There are natural remedies that could help you if your anxiety is getting in the way of your task at hand. If you get anxious in certain situations, like worried about a speech you have to give, you might notice that the symptoms are gone after the speech is given. Take back your thoughts. We often have negative thoughts in our minds about the situation. Take back your thoughts by challenging your fears. Practice focusing on deep breathing. To calm down the anxiety, you need to slow down your heart rate. You can do this by breathing in deeply, counting to 4, and breathe out counting to 4, for 5 minutes. Using aromatherapy. Aromatherapy helps activate certain receptors in your brain to help ease anxiety. They can be from a candle, oil, or incense form. Get a scent that is very relaxing like lavender, sandalwood, and chamomile. Going for a walk. Going for a walk is the best way to stop anxious thoughts. It will help you relax and calm down your mind and anxiety. Write it down. Get your thoughts out of your head and down on some paper. Whatever is making you anxious, to write it down. This can make it less daunting. If your anxiety is sporadic, then this is very helpful for your anxiety. This will also work well for someone with generalized anxiety disorder known as GAD, but you should also find long-term strategies to lessen the symptoms and stop them from happening. Long-term coping strategies. If your anxiety is an everyday thing, it is important to find a mental health doctor, so you can find the right treatment strategy for you. This can be a combination of things, like meditation, therapy, or both. Learn to manage and identify your triggers. Some triggers are obvious, like drinking caffeine or alcohol, but some are less obvious. It could be some problems you are having, like stress at work, financial issues, or can be relationship issues. When you figure out your triggers, make sure to limit them or cut them out of your life. If you are unable to do this, because it is work or financial, then use some coping techniques to help you. Some common triggers. Depression. Caffeine. Genetics, it could run in your family. A stressful work environment. Withdrawals from either meditation or drugs. Side effects from medications. Driving or travel. Chronic illness such as diabetes, asthma, heart disease, or cancer. Chronic pain. Trauma that happens. CBT or cognitive behavioral therapy. Cognitive behavioral therapy helps you to learn a different way of thinking to react to situations that cause your anxiety. Your therapist can teach you ways to change your negative thought patterns and behavior before they get worse. Meditate regularly. When you meditate, it helps train your brain to stop anxious thoughts when they come up. If it is difficult for you, try yoga. Stay healthy by diet and supplements. Researchers say certain supplements and nutrients can help reduce your anxiety, such as omega-3 fatty acids, green tea, kava kava, lemon balm, ashwagandha, Valerian root. Dark chocolate. Rich in magnesium like greens such as spinach, greens, Swiss chard or legumes, nuts, seeds, and whole grains. Probiotic foods like pickles, kefir, and sauerkraut. Asparagus. Rich in vitamin B like avocado and almonds. It can take up to 3 months before your body is running on nutrition. If you are taking medication, discuss herbal remedies with your doctor. Make sure to exercise regularly, sleep, eat healthily, and stay in touch with friends and family who love you. It eases the anxiety symptoms. I hope you enjoyed the video and found it helpful. If you did, let me know what helped you. Don't forget to like, comment, and subscribe to help the channel grow, so we can help as many people as we can.